Am I a candidate for dental implants? This is a common question we come across. Now, am I a candidate? I might have this could be my age, or this could be my sugar levels and blood pressure levels. Am I a candidate? What about the bone quality? Now, before placing implants, what is very important is we do a thorough assessment of the patient. Thorough assessment includes assessment of the bone. We need good foundation to place an implant. Okay, so we have to assess the bone. We have to assess the medical condition of the patient, whether all the parameters are in a reasonable state. When I say reasonable, a patient may be having diabetes. So, someone with diabetes, a very routinely asked question to us is, am I diabetic, can I have an implant done? Now, if anyone is a diabetic, it does not mean implants cannot be placed. Definitely implants can be placed, but the only criteria would be the diabetes should be controlled. If you have uncontrolled diabetes, definitely you are not a candidate. You can get back once your diabetic sugar levels are in control. Now, if you are a hypertensive, again, does not mean if you have a blood pressure, does not mean you cannot have implants. You have to get it under control. Once the blood pressure levels are in control, we can go in for implants. Now, what about the bone quality? Like I told you, we need good bone, like any foundation. Suppose you are building you're constructing a building, you need a good foundation for the building. You cannot build a very big building with a very small foundation. So, the foundation, I would say, is the bone. What happens is, generally once when we remove the teeth, when we extract the teeth, we would have such thick bone there. The teeth will be inside. Now, once the teeth is pulled out, this particular bone, it shrinks down. So, from this width, it comes to so small. Suppose I don't have bone, what do? Suppose I have lost bone over a couple of years, and now I do not have adequate bone. You can see in the picture there, to start with, on the extreme left, you can see it's a very narrow ridge, very narrow bone. Okay, probably just about 2 to 3 millimeters. So, in 2 to 3 millimeters, I cannot place implant, because my implant would generally be about 4 mm average. It depends, about 4 mm. So, I cannot place a 4 mm in a 2 mm bone. So, what are the options I have? We have alternate options for this, but only thing is, now the procedure shifts from a basic implant procedure to an advanced implant procedure, which is little technique sensitive and needs to be done with a lot of care. So, when we don't have bone, suppose I have just 2 to 3 mm of bone, how do I do it? Nowadays, we get something called bone grafts. We get artificial bone grafts, and as well we get bone grafts from the patient itself. When I say from the patient itself, we take out a little bit of bone from the other areas. There are specific areas where the bone can be grafted. We take out a little bit of bone from one particular area, then we get this artificial bone grafts which you have. There is a way to manage that. We build up this area, we add on the artificial bone grafts and the bone grafts from the patient, we add it up, and we have to wait. Once we have done it's a small surgery, we call it bone augmentation. Once the bone augmentation is done, we generally wait about 4 to 6 months. In 4 to 6 months, the artificial bone or the natural bone, it takes up, it joins to the bone, and we get a good platform, a good width of bone. So, once we have this bone, about after 4 to 6 months, we can place the implant. This is one way of handling lack of bone. We call it the bone augmentation. We come across a lot of cases where we see bone only in the front area. When I say front area, it would be from somewhere here to here. That is, we call it the premolars, first premolar to first premolar area, because we have a nerve running there. So, behind that general scenario is a long-term edentulous case, long-term cases where teeth has not been rehabilitated, we see a loss of bone height. In such cases, what we can do is, the problem we face in such cases, we have bone only till here. Just behind this, there is absolutely no bone. So, if I want to do a removable option, very easy. I place one here, I do the what I have explained earlier, implant supported overdenge. With 2 implants, I can give a removable. But there are a lot of situations where the patients demand only fixed option. You have to give us a fixed, we just do not want a removable option. So, does it mean we can just say, no, we cannot do it? No, there are some different techniques for that. If you have bone only in the front area, we still can manage it. We call it the all-on-4 concept, all-on-4 concept of management, which means that I can place just 4 implants. I place 2 here and 2 here, 2 implants here, but this particular implants will tilt it a little behind. So, the implant, though it starts here, when it ends, it comes a little bit behind. So, I get a longer span. So, it is a little bit of a mixture of engineering mixed here, mechanics mixed here. So, we have 2 implants straight and 2 implants tilted with a little bit of cantilever, I can say. we join the entire thing. You can see in the picture, this particular case has been beautifully done, where both the upper and lower arches have got 4 implants each, but with just 4 implants we have managed to give the entire arch. The entire arch is given, which means a fixed process is given just with 4 implants top and 4 implants down. Now let me repeat, this is not a normal scenario where with 4 implants I can give a fix. We don't do it. Only in special cases, with if we adopt a different technique or different approach to it, we can handle this case. This is how we can manage the deficient bone. Thank you for a patient hearing.